session because this is quite confusing even to date about what this particular disease is. And it's an evolving condition, and orthopedic science has not reached a place where we can definitely tell that this is the particular cause of Perthes disease, and that's how you're going to treat it. Okay, so we'll try to divide this particular disease into 4 parts. First, we'll be talking about the history, etiopathogenesis, and the natural history. Then we'll be talking about the prognostic factors, the various investigations that are done, and then we will talk about the classification systems and the treatment guidelines over the 3rd week. And lastly, for people who want to practically treat these patients, we will talk about in depth about the different treatment methods, be it bracing or femoral surgeries or the acetabular surgeries. So without further delay, let's just jump into this particular problem, which is Legg Calvé Perthes disease. So how did this start off? Perthes disease back in the day was initially described in 1909 and 1910 in different papers at the same time in 3 different areas. That is by Dr. Legg in Boston, USA, by Calvé in France, and by Perthes in Germany. And this is back in the day when we did not have WhatsApp or Telegram, and all 3 of them to have done it at the same time makes it logical that the disease is named after all 3 of them. So what they described this condition is that this is an obscure affliction of the hip. So we are talking about times where we did not really know what exactly this thing is. So the only 2 conditions back in the day which were definitely diagnosed in say pediatric and adolescent children was, one is the tuberculosis of the hip, and the second thing is the septic arthritis of the hip. Okay, and this particular condition mimicked tuberculosis and was being treated as tuberculosis for a very, very long time. Okay, and that's where Waldenström comes in. Waldenström in the same time period, that's between 1909 and 1910, has described this particular condition as tuberculosis of the hip, whereas Legg, Calvé, and Perthes defined it either due to some sort of trivial trauma, due to some abnormal osteogenesis, or due to an inflammatory condition, which to date we do not have a clear-cut answer to. Okay, so that's the initial description, and that's why these 4 gentlemen have been these 3 gentlemen in particular have been named after, the disease has been named after, and of course Waldenström from Sweden, who we should not forget because he also gave one of the named descriptions of this particular disorder. Okay, so coming to the etiology, when we started off in the say radiological eras, that's before say 1905, where any and every hip condition was called an osteochondritis, and soon after the development of X-ray, what happened is, I think this was towards the end of the 19th century. It's about 1895, if I'm not mistaken, when X-ray was discovered and was invented rather, and the X-ray machine within a few months was present all over Western and Central Europe. The reason for that is because when something is really good, you do not need to advertise about it. So X-ray was so good because it was allowing the doctors to see what's happening without doing a surgery. So that is why within a few months of X-ray being discovered, the X-ray machine was present in the hospitals all over Western Europe. And that's the time period where any and every overgrowth or outpouching of the bone was named after a particular doctor. So we had Osgood-Schlatter disease, we had the Freiberg's disease, we had Sinding-Larsen disease. So all these named osteochondrosis happened during this era, right after X-ray was diagnosed, and everybody was fond of naming a disease after themselves. Okay, and it was not later on not until 1921, where histopathologically, they try to examine these particular conditions. And Femister in 1921 found out that there is a combination of healing and necrotic bone intermingled with granulation tissue and osteoclasts. So what does this show us? That there is a combination of both catabolic and anabolic components. That is, both osteoblasts and osteoclasts are present in a soft tissue bed which has both necrotic bone and granulation tissue. Okay, and this of course confirms because of the radiology, of course, because this is a aseptic necrosis which slowly revascularizes. Okay, the staging of the disease is such that initially we have an aseptic necrosis which will lead to the osteoclasts coming in, followed by revascularization where osteoblasts come in. Okay, however, Femister did not tell us whether this condition was due to inflammatory condition or infectious condition, and the true etiology remained unanswered even back after the histopathological analysis. Then later in 1926, the theory that disruption of the blood supply to the femoral head is the most important etiological factor came out as the forerunner or the most important etiological factor leading to Perthes disease. And different pathologists, surgeons, and scientists found out that different arteries can be occluded, which would give rise to a Perthes disease sort of a picture. So initially, it was thought that it's due to obstruction of the superior retinacular artery. Then it was told that lateral epiphyseal artery interruption causes Perthes disease. Then we had the double infarction theory. And then when all the vessels were taken off, then they told that the blood itself is wrong, that it's due to the increased blood viscosity and due to thrombophilia, where there is increased clotting in these particular individuals. Okay, so disruption of the blood supply to the femoral head. Okay, so it's not just intravascular, but also extravascular and mixed. Okay, so that means not just the vessels, but also the blood which runs inside them was deemed to be problematic in these particular children. Okay, so that's when the multifactorial sort of etiology came into being. So it was told that both genetic factors and environmental factors are important for Perthes disease to take place. And later this was refined and it was told that it has to be a genetic susceptibility with an environmental trigger. Okay, so the genetic susceptibility is something that most of us could be born with, but until and unless there is an environmental trigger which is triggering this particular genetic susceptibility to come forward, the Perthes disease phenotype will not be shown. So this genetic susceptibility to environmental trigger, we'll try to break it down. So etiology wise, genetically, we could be having a mutation in the type 2 collagen or other hereditary factors which lead to a mutation in the type 2 collagen. Now, this was found very commonly in the Asian population, but rest of the population did not show a say a mutation which led to this particular disease. Okay, then it was told that insulin-like growth factor 1 pathway, which all of us know that IGF-1 pathway is important for the growth of both bones and the brain. Now, if there was an abnormality in this particular IGF-1, then it was told that both the bone and the brain will not work, which will lead to hyperactivity or sort of a attention deficit hyperactivity disorder in this particular children, which would lead to subclinical trauma due to the hyperactivity. And this subclinical trauma would lead to femoral head dysvascularity. Okay, so these were the genetic susceptibilities. What were the other problems apart from say the collagen structure and the enzymes? It was the blood itself, which we have already talked about. It could be a coagulopathy, a thrombophilia. It could be a vasculopathy leading to which would lead to a alteration in the blood supply to the femoral head. It could be both due to arterial occlusion or venous stasis, which would lead to stasis or hypoxia of the